The Week with Ben Ellis.
This is Switch.
The news broke this week that Birmingham is now on the watch list of towns and cities in the country where coronavirus cases have increased, and if things do not improve over the next week or so, then Birmingham could face itself in a local lockdown. Joining me on the line right now is Dr Rob Lamkin-Williams, who is an independent virologist at virologistconsultant.com. Dr Lamkin-Williams, good morning.
Good morning.
Good morning. And yeah, so this is big news. I mean, we've seen in parts of the country, sort of like the Greater Manchester area, sort of the towns associated with that part of the country, so sort of like Oldham and Blackburn and what have you. But the first actual major city in itself that now is on the watch list.
It's huge news. I mean, the number of cases doubled. There's been a slight decline on Friday, I think, but you know, that was a big surge that was observed in Birmingham. So it's not surprising it suddenly jumped up the league table. It's always been there. It's been in the background. It would be expected in a large city, and particularly a large city unlike London, where London gets hollowed out. And so you don't necessarily see these surges as such. But Birmingham, you know, I used to live in the West Midlands, so I know Birmingham fairly well. And it is the sort of city where you're going to see this sort of problem. Big surges, very rapid surges.
I think it's telling as well that when we've had coronavirus issues on the show in previous weeks, we've spoken to the Director for Public Health for Birmingham, Dr. Justin Varney. He wasn't available this week, so we do appreciate you coming on. But I think that's telling, isn't it? That he was too busy to join us given the circumstances.
Indeed, and one of the good things that has happened actually is the switch away from the centralised try and track and trace, the centralised model that was being implemented, and much more of a local thing. It is a pain because you do have anomalies like certain bits of the city being locked down in different ways and people across the streets having different rules applied. Gets confusing, but that more localized approach is very effective, and I think that's what we have been learning over the last few weeks. So I'm not surprised he's very busy. I think it's a good thing.
And there's been some guidance published. They're not the rules now, but they are very much the guidelines, and it's on a voluntary basis for what we need to be doing in Birmingham. Can we just outline some of those?
Yeah, I mean it's like there's no mixing of households. There's the there's the increased fines for actually across the board, but increased fines for major gatherings over 30 people. All of those things, particularly not mixing of more than one household, basically. And all of those, and it does create anomalies. It does mean that because it's certain boroughs that are applying them and certain other ones aren't, that you will get those strange things. But I think people have to just accept you have to draw a line somewhere. And if we can keep to that, that is a really important thing. So if people can follow the messaging that is out there, which can be a bit confusing at times, if they can follow that, that's really important. You know, we have seen a growing level of complacency about the virus because we have seen it decline. We are expecting it to get much worse going into the winter, and so we can actually manage our way through this. But people do need to, you know, to follow the guidelines they're given. And if we're going to get the schools back in September, which we have to do, then people need to actually really follow the advice.
And telling as well that although we're trying to come out of lockdown and we're trying to get back to what we perceive to be some form of normalcy or normality, the World Health Organization are still saying we'll be happy if this thing's gone within 2 years.
2 years is fairly optimistic. You know, I think we'll be living with this in some sort of way for at least 2 years. And in fact, it will become part of life. I mean, the virus, we will get to manage, we will get to control, we will end up with a vaccine. We're not going to have a vaccine by the end of this year. We'll probably sometime next year, we will have a vaccine for those people who are most at risk. But we're going to have to manage our way through this. And the localized way of doing it is probably a good way of doing it. Nobody wants to go back to a national lockdown, and that would be quite an extreme thing to do. But it had to be done when it was done because we didn't know what was going on. And the quickest and sharpest way of doing it was that lockdown. It's probably too late in the UK's case, but you know, it was what it was with the information people had. But now there's a lot more information being gathered, which allows us to do this localized.
What do you make of the announcement from the Health Secretary, Matt Hancock, this week that Public Health England is changed and it's gone there?
I would suggest that wasn't a great idea in the middle of a pandemic. I think it's been on the cards for some time, and I think there's a little bit of scapegoating going on there, to be honest. But it certainly makes sense to have an agency that is for health protection. And we used to have one called Health Protection Agency that was subsumed into Public Health England. And now we've just recreated what we used to have, which was dedicated to this sort of problem. And so there is a logic to doing what he's doing, but now is not the time to have done it. But it's going to distract people.
Absolutely, it's interesting, like the mindset or the way we look at things nowadays. I've not spoken to anybody since March who's had a cold.
No,
the common cold hasn't gone anywhere.
no, but we don't shake hands. We don't hug people. Australia has not had a flu season this year. Australia has their flu season around now, and they've got a bad COVID outbreak as well at the moment, a very serious COVID outbreak in Australia. But they've hardly got any flu whatsoever. And the reason is simply that the lockdowns are in place across Australia, and so people aren't transmitting normal colds and that sort of thing. Now, the worry is that we might go into a lax form of quarantines, lockdowns in the UK, and flu will come back. So hence we're going to vaccinate, or hope to vaccinate, everybody over 50 with the flu vaccine this year. And that's the intention, and children up to the age of 18. So it's like that, to try and contain flu in the UK, because we don't want both viruses around at the same time. That would be an immense strain on the NHS.
And just coming back to vaccines, which we talked about a little bit earlier, I'm sensing you're not putting much credence into the Russian vaccine.
No. Well, it's the vaccine they've got is a fairly reasonable vaccine, but there are two, in fact. There's a Chinese one and a Russian one that have both been approved by their national governments. So they're technically approved vaccines. The Chinese one and Russian one are very similar. And they're very similar to a vaccine that's been developed in the UK as well. But they've rushed them through a little bit too quickly, and nobody wants a vaccine out there that has not gone through all the proper checks. So the emphasis is to get a vaccine developed as quickly as possible, but to make sure it's as safe as possible at the same time. So those vaccines I would be very cautious of. And the way we are managing in the UK, Europe and the US, they are going through the proper rigorous checks before they go out into people.
And just finally, this time next week, prediction time, will Birmingham be in some form of lockdown?
Probably.
Dr. Rob Lamkin-Williams, thank you very much for joining us.
No problem.
For more great videos from the week, make sure you subscribe to our channel. It's down here somewhere. And don't forget, you can catch us on the radio every Sunday between 12 and 2 on FM across Birmingham, 107.5, on mobile, on DAB and online. We're made for Birmingham. This is Switch Radio.